Now available on the SIBODoctor.com, the SIBO Success Plan, a course for people with SIBO to help educate and take action. Whether you're working with a practitioner or are battling SIBO out on your own, this course will teach you how to beat SIBO for good. Visit thesibodoctor.com for more info. Welcome back to part 2 of the SIBO Doctor podcast, and let's jump right back into it. Okay, so what about the people, because this has been open to debate for some time now, about glyphosate, So what do you say to people that say, okay, the non-celiac gluten sensitivity is basically just glyphosate sensitivity?
Right. So we have theories of both why is there a rise in the incidence of celiac disease, and where did non-celiac gluten sensitivity come from? Because we've been eating wheat, we know we've been growing and eating wheat for at least 10,000 years, right? Agriculture was created roughly 10,000 years ago in the human population. Celiac disease has been around since the second year AD. So we know that's a physician labeled it as celiac disease. But non-celiac gluten sensitivity is kind of new. We think it might be from the increase in gluten protein in the hybridization of wheat. So wheat is not commercially available, genetically modified. University of Washington is doing a lot of research in it. And then there's also a barley that's being grown in Australia that's low gluten, genetically modified wheat in University of Washington, low gluten. So they're trying to create these gluten-containing grains with low gluten, but that's not commercially available. So wheat has been hybridized. I had a patient whose uncle worked his entire life in trying to increase the quantity of gluten, the amount of gluten in a wheat grain. And that was his job his whole life. And then his niece ends up being diagnosed with non-celiac gluten sensitivity. He had retired, but he was mourning. He was fretful. He was so regretful of his life's work. And he had been so proud of it. And he felt that he had caused his nieces, who had so many symptoms for so long, came to see me and we figured it out. So glyphosate. So glyphosate is, for those who don't know, the named active ingredient in Roundup, a weed killer. So there's other chemicals in Roundup that we don't even know. Since it's a proprietary formula, we don't even know what the other chemicals are. But we know glyphosate's already a bad problem. So Dr. Stephanie Seneff from MIT wrote a paper years ago postulating that glyphosate and the advent of glyphosate mirrors the rise in celiac disease. And maybe this is a cause, because what glyphosate does to these weeds and to the soil organisms is inhibit enzymes and inhibit the nutrient uptake of those organisms. And it could be doing that to us as well. And there's a variety of other, which is really horrific for soil organisms. And they have that genetic change in them forever for the life of those soil organisms. And we need soil organisms to have healthy soil. So using Roundup is just unconscionable. And she proposed a variety of other processes by which weeds and soil organisms are damaged, and that might be causing the damage in celiacs as well, and why we have an increased rate. So eating organic, we know there's a slight increase in nutrients. So I do recommend eating organic for my celiac and non-celiac gluten sensitivity patients.
All foods, not obviously no gluten, but just generally organic across the board.
Yeah, organic foods, yeah. But also just to reduce inflammation, because we do know that whether it's a weed killer, so or a pesticide or a fungicide, that we need to reduce these because they do cause inflammation. We know that. So we don't have research on on what happens with a fungicide and an herbicide and an insecticide together in a human body, because that would be horrific to try to do to humans. But we have them in a variety of other studies on other organisms.
So it's possible. What you're saying is it's possible that glyphosate is involved in the development of non-celiac gluten sensitivity. Has there been any research to look at those that eat either just organic wheat products and do people, so wouldn't it mean that there is, like, if you're non-celiac gluten sensitivity or sensitive patients, if they eat organic foods or organic gluten products, those symptoms still occur, right?
Correct.
So I think we're all in agreement that we've all seen that. People still, it doesn't matter if it's organic or not. So wouldn't that take the glyphosate conversation off the table? Or was that the initial insult that maybe triggered this response?
Well, one thing about glyphosate is, for example, for those soil organisms, it gets into their DNA. So if we have ever eaten regular wheat, which I have, and I probably didn't start eating organic wheat until maybe 20 plus years ago, but I had a life of regular wheat. Who knows what's in my DNA? Who knows what's, and that's the thing, is we think non-celiac gluten sensitivity, another proposed etiology is a change in genetics. Environmental factors, ATIs, microbiome issues. Absolutely. Amylase trypsin inhibitors, which are sort of a natural insecticide compound in wheat, that lectins, which have been proposed too. So we don't know it's such a new disease. 2011, it's been crazy. No time at all. Yeah. It's been no time at all.
Did Alessio Fasano's research, and was that involved in the development or the discovery of all of that, or was that also independent?
Yeah, so he was involved. He was one of those celiac experts, gastroenterologists, who got together in London, and then again at the International Celiac Disease Symposium in Oslo in 2011. Yeah,
because he was like. He was talking about, when I went to a conference where he spoke, he talked about that basically gluten causes microinflammation in all of us.
Yes, he did that study when he was in Maryland at the University of Maryland Celiac Disease Research Center. And indeed, he gave healthy non-celiacs a capsule full of gluten, and across the board, everybody had leaky gut.
Wow.
I don't know for how long.
Yeah.
But still, that's a capsule. Yeah. And here we are eating these mounds of pasta as Americans.
Frightening.
Subway sandwiches.
And Australians.
Yeah, and pancakes and waffles and pretzels and sandwiches. And wheat is, and that's one thing that's postulated too. We've never eaten as much wheat as a population as we do now. And then unfortunately, America has exported its fast food culture. Kentucky Fried Chicken, which is coated with wheat and which is served with rolls, is in almost every country. McDonald's and Wendy's and all the fast food places. So more humans on this planet are eating wheat more than ever before.
Yeah. Okay, so let's finally move into the relationship to SIBO.
Yes.
It's so fascinating, and I'm so glad I'm talking to you, because it's sometimes, when I'm, as a digestive specialist, this is just always on our radar. Is this something that we need to check for?
Right.
And, it seems like things have changed in the recent year in terms of even blood markers and how to properly diagnose this. So I'm really happy we're having this conversation. So talk to us about SIBO and either celiac and non-celiac gluten sensitivity.
Right. And I also just want to do a shout out for wheat allergy. So wheat allergy, a lot of people think, allergy, hives, anaphylaxis, asthma, my mouth is my clothing, or my throat is closing, my tongue is swelling up. However, wheat allergy can show up as diarrhea. It can show up as reflux. It can show up as a lot of different digestive. So if somebody says, oh, every time I eat, I have to run to the bathroom. You're like, wow, what's going on there? Wheat allergy is not necessarily first on your differential diagnosis. And I think we have to bring that into the fold. There was a piece of research that came out in January that said 1 in 10 Americans have a food allergy. That's huge.
I was actually thinking only 1 in 10, you know, like IgE allergy, or IgE, like they're saying IgE. Allergy. Okay, no, that's true pretty allergy. High. That's true.
That's really high. Really high. Yeah.
And it's on the rise.
And it's on the rise, like crazy on the rise.
So when you say wheat allergy, these are the IgG and IgA to the wheat, you know, like for example, the US biotech panels or so.
Yeah, they might be negative to IgA and IgG, but they're positive with an IgE.
Oh, IgE. Okay.
Right. And
so you're talking true allergy.
True allergy. Yeah, true. Wow. This is not a wheat food sensitivity. This is a true allergy.
So in your panel, you would include just an IgE total or just an IgG wheat?
Yeah, wheat IgE. And frankly, I do run a total IgE whenever I run a blood true allergy on anybody for any cause, because IgE deficiency exists too. And if somebody has an IgE deficiency, I'm like, what is going on with your immune system? And I suspect, a true allergy.
Okay, lots of things to consider. Yeah. Back to SIBO.
Yeah.
How does it relate to SIBO? I mean, we know that it's one of those associated conditions, celiac disease for sure. Yeah. But talk to us about what you think is going on there.
Right. So luckily, there is research that shows celiacs do not have an increased risk for SIBO. They have the same risk as the general population. So when I read that, I was happy. But I do look for SIBO in my celiacs who have given up wheat and have changed all of their household products are now gluten-free. So their pet food, their fish food, their chapstick, their shampoo, everything. Everything is gluten-free. And they still don't feel better. SIBO's on my differential diagnosis. And so we have to figure out, is it something going in the small intestine? Is it something going on in the large intestine? You know, is it an uninvited critter like a protozoa or a parasite or bacteria that's pathogenic? Or is it just an overgrowth in the small intestine or large intestine? Or is it some other autoimmune disease, right? Because celiac disease has a high rate of other autoimmune diseases. So if a patient comes to me with SIBO and they say, I've been treated 3 times and I never feel better on SIBO treatment, what else is going on? What is the obstacle there? Is it yeast? Is it heavy metals? Is it mold? Is it a parasite, right? All of those. But I also think, is it undiagnosed celiac disease and they're getting micro cross-contact? They're ingesting a little bit on a regular basis. And that's hard. Because for those of us who do SIBO, we throw somebody on a SIBO-friendly diet and it's often grain-free. And here in Portland, I mean, everyone's doing paleo or autoimmune protocol or carnivore or keto, and like they're all grain-free diets. And those people are, I feel so much better on this diet. Why? Do they have SIBO? Do they have celiac disease? Do they have non-celiac gluten sensitivity? What? Why do you feel better? Right?
Yeah, it's always about finding the underlying cause and treating that.
Absolutely.
So, you know, I have a little niggling question still about the, one of the first things you said about celiac disease is that it has, I think you said it has leaky gut as the component, which is the zonulin release, right? So do you also not often see that in the non-celiac gluten sensitive? Like, is there no connection to leaky gut?
They do have a higher percentage of leaky gut than healthy controls.
Healthy controls, yeah. I would be surprised because it's like, we know SIBO causes leaky gut. Yeah. We know that there is some sort of overlap with gluten intolerance to, or it's not called intolerant anymore. It's non-celiac gluten sensitive people.
Correct.
So across the board, leaky gut is the common denominator in all conditions.
Well, we don't know that leaky gut causes non-celiac gluten sensitivity. We know that people diagnosed with non-celiac gluten sensitivity have a higher rate of leaky gut.
Okay.
So, it's an infant. I mean, it's in its infancy as far as research. There's a lot of research coming down the pike. Yeah.
Do you treat somebody different that has either celiac or non-celiac gluten sensitivity? I mean, they also have SIBO. Is there any sort of, is it just run-of-the-mill SIBO treatment, or do you do something different other than the obvious gluten intolerance?
Right.
Removing gluten.
Obviously, I'm going to double-check all of my products to make sure they're 100% gluten-free.
Good point.
All the supplements.
Practitioners, listen up. I have made that mistake before.
And if you're prescribing pharmaceuticals, they have to be 100% gluten-free because wheat is often used as an incipient. An incipient means something other than the active chemical of the drug. So that means either the sweetener on the outside, the coating, the coloring, a flavoring, the filler, or the binder that sticks it all together. Any of those can be wheat-derived. Natural flavors can be wheat-derived.
And how do you find out?
You have to call the manufacturer.
Oh, geez. A lot of work.
It's a lot of work.
Yeah.
It's a lot of work. And as a physician, I can't do that. There are some websites that stay updated that can help a person who has celiac disease or non-celiac gluten sensitivity or wheat allergy or any of the other associated conditions for which they have to eat a gluten-free diet. There are websites that can, but any time and any day, a formulary can change. Right? The formulation of that drug can change. So I tell patients, keep a few of your old drugs and look at them. Take one out of the new prescription and the old prescription and look at them. Are they the same color? Are they the same shade? Do they have different numbers written on them? You just have to be vigilant constantly.
Wow. Yeah. I obviously have seen a lot of both celiacs and non-celiac gluten sensitivity in my practice. And it's a lot of education that goes into that. Now, before we also recorded, you said, let's make sure that we cover pediatrics and inflammation because there's some new research out.
So inflammation was, that there are cells in the lining of celiac small intestine that permanently turn inflammatory. Unfortunately, that's just a bummer. But it makes sense because celiacs have a higher rate of cancers and other diseases. And we know that all diseases have their root cause in inflammation. So that makes sense. So when it comes to kids, and I do not see a pediatric population, I see sort of self-possessed, mature teens and above. So I sort of high school and above. But in the research, infants who had some sort of antibiotic prescribed in their first year of birth have a higher incident of celiac disease. Makes sense. Leaky gut. And they're probably eating gluten, or their mom is eating gluten, and it's coming through the breast milk. The amount of gluten that is given to the child when it's first introduced to solid food can increase the risk of celiac disease or decrease. So we need to have a small amount of gluten, but not too much, or completely avoid it for the first year. If like cream of wheat is the first food introduced to a child, they're more likely to have celiac disease.
Wow.
But say if mashed yams and mashed peas and these sorts of foods, they are less likely to have celiac disease. If a child has more than 3 infections, viral or bacterial, first 1, 2, or 3 years, I can't remember exactly.
Which is all kids.
All kids, they're more likely to have celiac disease. So I'm like, there are kids that don't get infections in their first year or 2 or whatever it was. I don't remember how old they were, but it was very young, very babies. I'm like, wow, like that means they have controls. They found babies who don't get snotty noses and,
Wow.
Yeah, that's kind of amazing.
It is.
So it's about trying not, to have antibiotics given to a baby. We know that can mess up their microbiome. Obviously, it's causing leaky gut because it's triggering celiac disease, and celiac isn't triggered without leaky gut. So it's about, but the research didn't show what about non-pharmaceutical, like herbal antibiotics. There was no research on that. But I'm guessing if you use the whole plant will be more protective to our microbiome by using an herbal antibiotic.
Some herbs are more damaging. Like, for example, the whole grapefruit seed extract. And then oregano oil is also not very discriminatory in terms of what it kills, or like less discriminatory than something like berberine.
Right.
Where we really are. I'm always talking to my patients about that. I really don't want them on long-term antimicrobials, whether they're herbal or conventional. So that kind of triggered something, which of course I forgot now, but it was about. Oh yeah, that's right. So are you advocating for a gluten-free diet the first year of life?
It depends on the family genetics. So if I were a celiac, I would be eating 100% gluten-free. I probably would not introduce wheat the first year, but there's some sort of research, and I have to dig back, and I don't see kids, and that's why I don't remember this research too well. But there was something about if you don't have any wheat at all for a certain amount of years, and I don't know what that is, 2, 3, 4 years, and then introduce it, that can cause an increased rate. So there's sort of this balance. So if, moms, so if I was a celiac and I was breastfeeding, I wouldn't be eating gluten, right? So they wouldn't get it through my breast milk. But not having like a cream of wheat type of product or any product that has wheat in it as one of the first foods is protective. And then very small amounts. So the larger the amount of gluten in their first year, the higher the chance of celiac disease. The lower amount of gluten, the lower chance of celiac disease. So
it makes so much sense because, like, if you think that the infant gut is supposed to be porous, right? It's supposed to just allow for this passive almost absorption of immunoglobulins and things like that. So it makes sense. And have you found anything, or what do you do, like I said, besides, what are your favorite go-tos for healing leaky gut besides removing all gluten from their life?
Right. So the first thing I talk about is lifestyle. Because I could throw all sorts of supplements and vitamins and minerals, and if they're stressed out, they're stressed out. Now, that being said, if I'm talking to a single mother of 3 kids working 2 jobs, that's going to be hard to address lifestyle. And what I mean by lifestyle is calming down, getting out of the fight or flight and getting into the calm, rest, and digest. So I have several handouts on those. The first start is conscious eating, about people sitting, breathing at the dinner table or the meal, looking at the food and expressing gratitude. Expressing gratitude swings us into parasympathetic rest and digest. Chewing well, eating slowly, if they can, enjoying somebody with their meal, having somebody with them. So many people eat alone at their desk. Not doing any work, not watching TV, not skimming through their news feed, just listening to music and relaxing. And that has a huge effect on the gut because the nerve that we know into the small intestine starts in the brain. And if we can, and that nerve, the vagus nerve, only works in a parasympathetic state. So if we can get them in a parasympathetic state during mealtime, we're going to have the secretions in the mouth and the stomach, pancreas, liver, gallbladder, and the lining of the small intestine increase and function appropriately. And then I give them another handout on these rest and digest parasympathetic activities between meals. So you can't just be calm and then be a freakazoid at the office. It's just not going to work. So I recommend guided meditation or even meditation for 5 minutes shows a greater parasympathetic tone for a new number of hours afterwards, several hours afterwards. Taking breaks, laughing, if your desk is next to somebody who drives you crazy, ask your boss to move your desk, or if you're the boss, move your desk, or, reposition yourself somehow. If you hate your job, think about plans to somehow change your job if you're in a stressful environment. So that's huge. And I talk about that, and I talk about heart rate variability, and if there are emotions, I talk about a variety of techniques I do to sort of reprogram emotions. I do a lot of acupuncture on these people to help calm down, and it can really get that parasympathetic dominance going.
Great.
Because I'm also a licensed acupuncturist. So massage and cupping, I do a lot of massage and cupping on my patients. So that's that's part of the lifestyle part. And that's a lot of different visits that I have to talk about with patients. And then as far as supplements, it's tricky if they have SIBO as well as celiac disease, because with just celiac disease, we can use our demulcents in pretty high quantities. But I find those are a little tricky in our patients with SIBO, because some people might react to the lovely aloe vera and slippery elm and marshmallow type of plants, licorice root, powdered licorice root. But some of them do pretty well on with SIBO, sort of some brands of aloe vera. I find that they can do pretty well.
I do too. I find aloe, like liquid aloe.
Yeah,
it's
liquid
pretty
aloe.
good.
Yeah.
Really nice.
Yeah, so I use that. And there is that newer research from, I think, a year ago that showed, we talk about demulcents and that whole plant family as being calm and soothing and healing, such as aloe to a sunburn. But what we know now is they're actually, it goes deep into the mucosa and it turns off inflammation. So that's why these demulcents are working, of course. Like why it's just not topical. So that's what I want to do too for my celiacs, is turn off that inflammation as much as I can and get that gut healed. I use pretty high dose vitamin A and vitamin D for a short period of time. I will use some sort of an anti-inflammatory, preferably via food. So I try to talk them about smash fish. About smash fish?
Never heard of it.
Sardine, mackerel, anchovy, salmon, herring. All those foods that are high in essential fatty acids. So I call those smash fish.
Oh, the acronym. I was just like, do you make a smoothie out of it?
Basomatic. Yeah, you just put it right into this.
Basomatic. Oh, my God. Yeah. Great. Great. I mean, that was just totally, I echo everything you just said about stress reduction.
It's number one. Number one. Or else you'll just be chasing your tail.
Absolutely.
They'll just have SIBO again, and they're just going to have leaky gut again, and then they're going to have less foods they can eat, and more food sensitivities.
And so many of our patients, as SIBO experts, that we see have painted themselves into a corner with all sorts of limited food choices that they have, and still have leaky gut. I use the Dunwoody lab. That's another lab that gives me the zonulin, also the diamine oxidase, and I also no affiliation with this lab. I'm kind of limited with what I can do, but so some of it is I find very useful. Okay, well, that is so excellent. Was there anything else that you can think of that is really pertaining to this topic of SIBO and celiac disease that I probably should have asked you and didn't?
I'm just going to repeat again. What I like to repeat is when a patient comes to us with GI issues, or really any symptoms, we have to be screening for celiac disease. Because if we're going to put them on a healing diet, like a low FODMAP diet, it's not necessarily a gluten-free diet, but it often is. Or a specific carbohydrate diet, or a GAPS diet, or the SIBO-specific diet, or
the SIBO biphasic diet.
The biphasic diet, right? Or the fast track diet. So a lot of these are low gluten, and some people just it's just easier to go grain-free, or they feel better when they go grain-free. And if they've already gone grain-free, then it's very difficult to backtrack, have them eat gluten. So I just encourage us to be testing, do thorough testing for celiac disease before putting somebody on a healing diet.
That's really important. So are you saying that if somebody comes in, you're suspecting SIBO, still test for celiac?
Yeah. Just run a blood test for celiac disease and run a 3-hour lactulose or glucose breath test for SIBO. But some of these symptoms might also be in the large intestine. So maybe run a stool panel as well. I mean, I often do. I run those 3 tests frequently on people.
The TTG, the stool antigen, is it?
Oh, no, just like a broad spectrum stool panel to look at, especially if they're having diarrhea, do they have an elevated calprotectin?
Yeah, absolutely.
Especially if they mention blood, it's like, what?
Yeah.
We have to rule out, is there an IBD component? And that's an easy start to do that before sending them for a colonoscopy.
So who does the stool TTG?
It's called Interolab.
Oh, Interolab, you mentioned that.
And they actually, that is my preferred genetic panel. Because instead of getting just a qualitative yes or no, you have the genes, they kind of give a quantitative. So they say, yes, you have these genes, HLA-DQ2 and or HLA-DQ8, but you have these subtypes. And these subtypes are either highly suspicious of celiac disease or much less likely of celiac disease, or more indicative of non-celiac gluten sensitivity. So that's really exciting. They're not confirming, they can't confirm, but I like, instead of saying, yes, you have the genes, it's like, oh, but you have these subtypes of genes that gives you a little more information leaning towards or leaning away to celiac disease. So that's really helpful too.
Very helpful. I think a lot of us,
especially in kids, it's poo. You can just get from their diaper or just have them poo in a cup, and versus a blood test. Or for people who are needle phobic or just really panic with a blood draw, it's just a really nice option, another option to have.
Fantastic. Well, I just feel like there's like hours more content that we could talk about, but sadly, we have to end this podcast. This is going to be a 2-parter, so we're probably at the end of part 2 at this point. Tell us where people can find you. I know you're very busy. You have, like you said, an extremely long waiting list, but...
Yes, so I do have a long waiting list, but I do see celiacs. So celiac disease is my passion. It's about half of my practice. Other GI disorders such as SIBO makes up the other half. But if you want to call and come and see me, you have to say the magic word, I have celiac disease, or I suspect I have celiac disease, I want to be tested, or I have non-celiac gluten sensitivity. And we'll put you on the short list, which means we'll get you scheduled in a month or so. So that's why I leave room in my schedule, is to see people immediately, because so many physicians are mismanaging celiac disease and not diagnosing and missing celiac disease and not testing appropriately. So that's why I love seeing celiacs. It's just my passion.
And your website, like we'll have Dr. Shaver's bio and all of the relevant web presence on in the show notes. But tell us where people can find you. What's the website?
Yeah, so it's Be Well Everyday, bewelleveryday.com.
Okay. And you're in beautiful downtown Portland.
I am,
Yeah. And you've been there for a while. How wonderful. Well, thank you so much, Dr. Shaver. This has been extremely informative, and I'm sure we'll have you on the show again in the future as things develop, and hopefully come down to Australia one day.
Anytime.
All right. Thanks very much.
Thank you.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.